This conference will now be recorded.
Well, I guess we're being recorded. I better watch what I say. And can you hear us okay, Tom?
We gotcha.
Okay, so we have two other people joining us, Tom and Jonathan, both in California, where EMS, Educational Messaging Services, is located and housed. But how we got into this process, in particular through Canvas, is that I, along with Tom and Jonathan, developed the Text for Life suicide prevention program that began here about 10 years ago in the state of Minnesota. And I was so impressed with the flexibility and the dynamic use of this texting system that after I left Canvas, I stayed involved with EMS and continued to look at other options and applications for the texting process that make sense, especially in the area of human services. So I will introduce Tom Evans, who is the CEO of EMS, and let him take over.
Thank you, Mark. And like you said, we have Jonathan Hawley here, who's our Chief Operating Officer, who's going to provide information as well. And it's a pleasure to meet everybody. Thanks for participating in this. I think to begin, to put everything into context, Educational Message Services is an agency that dedicates to health and human services 100%. Since 1994, we've been involved in what we like to call health promotion. We're a for-profit entity, however, our clients are 100% nonprofits. And so built in good public health and disciplines that are consistent with programs that are both implemented and evaluated is where we go with all of the work that we do. So by starting the program with a couple of citations about texting, we see that from recent findings in the American Journal of Preventive Medicine that text message interventions are capable of producing positive change in preventive health behaviors. And it is found, too, that these changes from the preliminary evidence are maintained even after the intervention stops. Again, another citation from the National Institutes of Health show that there's a growing body of evidence that demonstrates text messaging-based programs on mobile phones can help people modify health behaviors, and that this is consistent with automated and sometimes interactive text messaging. We're going to show you both of those kinds of text programs today that guide people through a process of behavior change. So for health and for social service, these programs have been highly effective, especially when you expand them to create not only content that's delivered by your phone, but also links, which we'll show here too today, links to websites, as NIH has found to be very effective. So if we can change the slide. In Minnesota, we are working with quite a few agencies, the Greater Twin Cities 211, the St. Louis County Health Department, the Minnesota Department of Human Services, Minnesota AIDS Project, the University of Minnesota, Mental Health Minnesota, Campus Health, Police Department, and one that isn't on this list but is also being worked with currently is the Southern Prairie Community Care. Mark, is there anything you'd like to add to that?
No, I just know that, this platform has started to gain some momentum here in Minnesota, and we're hoping that we can continue to do that. The more people who are using it, again, the more interchange that people can have with each other about it. So just a heads up, Tom, there's about 8 people in the room, and what I don't know is the departments people are from. So let me just do a quick count so we know. How many people are here potentially from corrections? Okay, we have 0 corrections right now in the morning. Community services, we have 3 community services, and health department. We got 1 health department, and what's the other departments we've got?
Public Works.
Public Works, okay, great. And taxpayer services, we can pay our taxes here. Okay, Tom,
Oh,
we're
well,
ready to go.
we've got a, that's great. We've got a tax program that we're
I know
going
you
to,
do.
we're going to show you here. So that's great.
Hey,
Okay,
the
well,
library's here too.
Oh, the library's
Oh.
here.
Yes.
that's great. Well, texting has proven to add a huge value to libraries, as we've seen over time, as it relates to getting books back on time.
Definitely.
So, the examples of text capacity are many and wonderful, and just to quickly kind of highlight a few for today's presentation, we're going to talk a little bit about two-way texting, that kind of live exchange that you have with people in the moment, suited for a lot of different things, like helping people understand what they need for significant events that they are going to go to, and with that in mind, what might be necessary to bring and things of that nature, to get information and referrals out to people. Very significant that way in two-way texting, to have ongoing dialogue with people over time is proving to be an enormous boon, and text over phone has become the chosen method, communication channel for that, for helplines and numerous people. We're going to show you also highly automated and integrated texting. We're going to talk about some specific programs today that use that kind of service. Some use that service in combination with two-way texting. And we'll show you how to work texting for surveys and intake and determining eligibility in ways that I think you'll find very interesting. And then one of the things we wanted to show you as well today is how we can group message people all at the same time to help them with updates. And even as that is important too, some of the most important things that we're seeing are giving people sequenced messages or tracks of messages over time, alerts from time to time, reminders and appointment schedulings. You're going to see a lot of this kind of stuff as we go through these slides pretty quickly today. I'll go to the next slide. We wanted to start with the WIC program because as we were introduced to Washington County and now in Dakota County, WIC programs are coming on board for texting in a lot of places throughout the United States. What we're seeing in the main is that texting has improved enrollment and is adding to nutritional contacts for WICs. Mark, I don't know if there's any WIC people in the room today, but these things are very important.
We have one. We have one here,
okay.
Tom.
We're getting from WIC sites much higher rates of breastfeeding, both in initiation and duration. We have less missed appointments, and very satisfied clients moving from phone-based communications over to text. They find it just to be very easy to maintain. And we're going to show you, if you can move to the next slide, a demonstration of how easy this really is right in the user interface today. So I'm going to pass it over to Jonathan and just make mention of the fact that text demo to, John, if you can put that slide back up for just a second.
Sure.
All right, you see at the bottom of that slide it says text demo to 85511. Sorry for the slides moving around like this. Text demo to 85511. This is meant for you guys to do, and we're going to actually watch on the user interface as people actually text into this. So with that, we'll switch over to the user interface.
So in
And if
your
you
phone, all you're doing is you're putting the word demo and you're sending that word to the number 85511. And what will happen is you'll see your phone number appear here in the queue. So it's very simple. It's a simple process for somebody to follow. It's easy to understand, and the result is immediate, right? The result is instant. We're looking here at this queue, and this queue is designed like an email inbox, in that I can show the top 10, or I can show the top 15, and then I'm looking at the cases as they enter into my queue, kind of like an email inbox, but alive, right? So that the updates are happening in a live way. I don't have to click something to make it update. Whereas with your email, you maybe have to say, load emails or open or see new emails or something like that. This allows you to just simply be on the queue, open on this inbox, and the traffic will come to you. Now, you don't have to have a live response component. I mean, you can just be having people opting in or putting them into the system using the on-ramp, where you can actually put a phone number into the program, or you can put multiple phone numbers into the program, and then you can just add your clients that way, or they can text in like you've seen here. And you can have automated responses, everything automated. You're all getting a series of messages, a welcome message, and then sample messages of content that say might be delivered by a WIC agency in a public health environment, a series of messages that are strung together. You can have any series of messages strung together in any frequency. All of that is managed by your department. Under this simple little reminders tab, the series of messages that I had queue up for the demo today are just the beginning, the welcome message that you got, telling that you texted in this program, and then a series of messages that follow, and it's kind of like building blocks. If you're familiar with how you put together blocks, right? Legos. You start and you kind of build your way up, and it's the same way. You start with a parent message, and then you just build out from there. You build down instead of up. And your series of messages become the content that subscribers will get when they text your program. So educational content becomes really accessible and easy to manage, and then easy to send to clients. And then how that appears to the client, of course, is when I'm clicked on a phone number here in the queue, I see exactly what we sent them. And anything that is going to still be delivered would show up under our unsent toggle. So this client has 2 more messages in their queue that are going to go out in the next few seconds or next few minutes. And each one of you will have this same unsent. And it just means that these ones are scheduled to go out rather than already sent. The already sent is just there, right? So that we see the already sent messages and then the unsent messages, which are queued for delivery. So you always have complete surveillance over all messages that are in the pipeline, as well as messages that already have been sent and are part of their message stream. And then with each outgoing message, you get carrier-grade message delivery receipts, which simply means that all the carriers are participating in that. They provisioned the number, they understand the communication that's happening on that number, and they're verifying every message that is delivered. So not just a system that says, sure, we sent your message. This system verifies that it got sent to that mobile handset and delivered to that mobile handset. And so if it's a Sprint client, we get verification from Sprint that, yep, we got it, and yep, we delivered it to your client's phone. So that is good for health and human services, because you never know when somebody's going to come to you and say, hey, I didn't get a text from you, and you promised you were going to send me that information, and now look, I missed the application deadline. It's your fault. And then you can say, no, actually, let me have your phone number. I'll look it up. And you can say, actually, we delivered to this mobile phone number at this time, and the carrier said so. Oh, so then it's about whether or not you have the right phone number for the client, not whether or not that message got delivered. Big difference, and it's a very important distinction. All of these messages are being delivered in an automated way. Now, let's say I want to have a conversation with one of these clients. Well, I can just click the one that I'm viewing and open it. And then I've got my conversational box and my canned phrases, which can be personalized, right? I made a library just for myself, but you can have libraries for, groups, everybody to use. And, like intros that we all approve of. These are greetings that we would say would be okay for a WIC environment. And then if you're in, health and safety, there might be a separate set of greetings, right, that are more consistent with the way you interact with your population. Each department gets their own queue or queues, multiple. So you're never having to sort through other people's clients. It's your clients always in your queue. So, and we can drill right down to a case manager that has a set of clients that just they work with. They can have their own, almost like their own email, right, where they're just interacting with their clients. So the queue can be a shared environment among multiple people, or it can be designated by individual. Very, very easy to scale across that way. And then when I'm conversing with the client, it's a mixture. It's a mixture of canned phrases or hand typed. I can always do it the old way and type out my message. Now, realize that the client is texting with their thumbs, or if they're extra handy, they might use the voice recognition or voice to text if they're in their car or something like that. But in the majority, they're going to be texting with their thumbs, right, and their however they do it on their mobile phone. So you've got a bit of an advantage because you're using this system, right? You're texting with a keyboard, and you've got canned phrases. So you might be a little bit quicker on the draw, right? You might be a little bit faster along the way as you engage with your clients, recognizing that they're texting from their phone. You're texting from the computer. Same channel. You won't jump channels on them or anything like that. And it will always stay text because the number is provisioned that way. It's not provisioned as a quasi-text, quasi-email, quasi-whatever, right? It's a texting number. And that's how it's understood by the carriers, and that's how it'll be delivered and used by your end user. So you won't get surprised by somebody texting you think from a mobile phone, but then you find out that number isn't a mobile phone number at all. It's a Skype number or something like that. You can't be sabotaged like that. You'll know that they're texting from a mobile phone.
Jonathan, can you give us an example of just typing in a message and
Sure.
showing how that shows up?
So I can just say, hi, how are you today, right? And send it. And then it goes out. It's quick. It's very fast. It goes to the client. I can also open up multiple clients, and I can go like each one of these folks here that texted in to this demo. And I can go groups, and I can say cases I own, which is all 7 that I just opened. And I can go, hi, this is you. And then I can send all of those people that group message, and they're all going to get it. But when they reply, I'm going to see their reply, not everybody in the group. And when I close my attributes and move that out of the way, I can actually see those appearing in each one of the chat logs. And the beauty of this is, guys, you can monitor and have conversation with multiple people at one time, because you can monitor these, what we refer to as background cases. Here's my primary that I'm texting with, and these are my background cases. And so I can have these, which I'm looking after, I'm caring for, because I opened them and I sent them a greeting. And so if my caseload requires me to reach out to 5 clients, I can pop them all open, send them a group text, and monitor their responses in a live way on this slate. So it's really nice that you have this surveillance over all of these conversations. And if I want to go here, I can just go there. And then now I'm texting with doing well response, right? If I want to go to awesome, I go to awesome. And then I'm texting with awesome.
Who's awesome in here?
These are the
but you can see, guys, just how robust this user interface really is. And this presentation here today is not meant to leave you knowing how to use this. We would give you orientation and training on how to use this service. But moreover, just to show you, like Jonathan said, it works like an email inbox. You get very accustomed to it, very familiar to it. There's dozens of things you can do, as you can see from all the tabs that we won't go into today. But I think what is important is that you know it's easy, it's instantaneous, and anyone can do it. As we found in training dozens, hundreds now of sites, usually they pick it up within an hour or two in the first orientation. So with that, I think we'll go back to the where we are in the slides and talk a little bit about some of the other features that might be of interest as we have multiple people in the room. There are numerous ways to use text in prescribed methods, like surveys. Snap, for instance, is a program that we have implemented in numerous states that allows people to opt in, or like Jonathan said, be opted in, instantly get the intake and assessment provided to them. And we're going to give you examples of a survey here in just a moment so you can see how easy this is to do. What it does, though, back behind the scenes is it gets an assessment made and gets to presumptive eligibility, which is important because that then instantly sends out a direct link to the nearest enrollment location for fulfillment. So text is really carrying a big burden here as it relates to all of the things that it needs to do, in essence, to make SNAP enrollments easier. And locations that have been using this have reported big increases in numbers of people that they've engaged and number of people that they actually have gotten reimbursements for. The federal standards on SNAP are set up in such a way that as you make these contacts with people and as you follow the ways in which we've got this SNAP assessment built, it actually qualifies each and every time that it's done automatically for a reimbursement. What that outcome does is, or what the outcomes from these programs indicate, is that it cuts staff time, which is, I think, on all of our minds. We've got increased enrollment. We've met the state and local objectives here, and that we've delivered a consistent service model in line with SNAP goals. This is just one program. If you go to the next slide. In St. Louis County. Yes, go on.
We have a question.
Could you give me an example of how a person would use the SNAP program or the SNAP part?
I couldn't hear that very well. I'm so sorry.
She wants to have an example of how people would use the SNAP.
An example of how they would use it?
Yeah, how someone would use it.
I can answer
Well,
that.
they would.
So there's a Q&A usually that is associated with eligibility, and that Q&A is usually managed by somebody either over the phone, or maybe they get a form that they fill out and they complete. We've converted that Q&A into a text message flow, so that I can work through, have I applied for a SNAP before? If so, how many months ago? Then I would disqualify myself from applying again. So, and then if not, I go forward in the survey, and then I get asked another question: am I a senior? Then I would get automatic eligibility if I'm a senior, or if I'm a veteran, I might get eligibility due to veteran status, or certain things would give me instant eligibility. Or then I might get to an income question. If you have this many people in your family, this is how much income you can have to qualify for SNAP. And then if I meet that, then I would advance to the final question. And then that final question might determine where in a state, for instance, if it's a statewide deployment, what site I would get referred to complete my enrollment. So maybe not the full enrollment package or the enrollment questions and Q&A, but perhaps the eligibility that then prepares the client for the full enrollment. So that would be one use case. Yep.
Yeah. The other thing, it might have also been part of your question, is I don't know, for instance, on websites here for the county, if someone's looking up for, you would have a text number there and they could just start the process that way right off of a website if somebody's doing it. Or if you advertise in the community, you can advertise at grocery stores, whatever you do that gives the information out for people to do that. Then all they have to do is text the number and that to the program, and then that starts the process for them. Is that kind of what you were getting at?
Yeah.
Yeah, okay.
Is
Michelle?
this being used in Minnesota right now for the SNAP example, or where is that?
Yeah, where is your SNAP programs being used right now, Tom?
Right now, it's
Indiana,
being used in Indiana
and Vermont.
and it's being also used in Vermont.
Okay.
Another
So
one more question.
Go ahead.
So for Washington County, when it comes to SNAP, we use combined application. And so it is not just food support, but it's also financial support and some other. I'm curious, are the ones that you've done right now standalone SNAP applications or eligibility intakes?
Right now, the ones that we've done are two types. There's different criteria in Vermont as there is in Indiana. The good news about the texting platform is that you can stack surveys one on top of the next and establish that you can handle multiple surveys, and they are adaptive. So if, like Jonathan says, if there's a question that takes you out or skips you to the next series of questions, the texting platform can handle that. Am I addressing that question the way you wanted?
Yeah, I think so. I mean, but you don't currently have an example of one where you're doing concurrent applications for multiple programs.
Concurrent applications for multiple programs.
So like financial assistance, TANF, and SNAP.
Oh, that's a great question.
Think of two separate federal programs.
Yeah, that's a great question. So we work a lot with 211, and 211 has that kind of encounter. But what they're doing is oftentimes they're assigning a survey to a client after they've talked with them a bit, texted back and forth with them. Then when we were looking at the user interface, there's a tool there where you can assign a survey. So you determine, okay, this person meets the criteria for this service. So if we assign this survey to them, they'll complete that survey. We can monitor it, watch it happen in a live way. when they're done with it, I'm going to assign the next little survey, and that survey is for a separate, general assistance or maybe some financial relief or maybe some support with their utility bill payment or whatever, so that there are multiple assessments, but it's not necessarily happening in a stacked, automated way that's completely being led by the end user. We see that as being a case manager-led situation, because you kind of have to watch and make sure the client makes it through that first survey before they start the second one. And I mean, we can do it. We can, like Tom said, we can stack surveys, but you kind of leave it to chance a little bit more if you don't have somebody, who's able to maybe monitor it or keep it in their background cases, just to make sure that that client is reacting to the survey properly.
I won't take up any more of your time. I just want to say that I'd love to have some maybe offline, deeper dive
Sure.
into that in terms of how that could be done.
Sure.
Definitely.
There's
Thank you.
nuances
You bet.
of surveys, and you asked a really excellent question. There's subtleties of surveys, and you have to be very very conscientious about and very deliberate about how you're building that and designing it so that it's user friendly. It's something that somebody can navigate through, and then also meets the needs of the motivation of the survey. Because if you don't do that, then there's no point of jumping channels.
Is
So
the
with
build
the-
of a survey,
Wait, Tom, one more question.
is the build of a survey or a process flow like that something that happens internally, or is that something that a request would be made for a process, a similar application process to be put into place externally by the vendor?
They would work with you on developing that. So if they've already have lots of platforms developed, if there's something that works that you can just adjust to, you can do that. If you had to build something from scratch, they would just work with you to build it. So it can be designed very specifically to whatever the needs are that you have.
As is the case with this program that's happening up in St. Louis County, that was an example of that, where we came in and built the survey based on criteria for eligibility, again, immediately linked people with case management based on the way in which the surveys were monitored and responded to, and been successful in helping them with their shelter needs. I'm going to skip to the next slide.
And that homeless eligibility, what that tries to do is, through the reentry program that St. Louis County is doing, they're working in tandem with the local 211 to determine whether or not an individual meets some of the criteria that they're doing to help rehome them or find them something more permanent, as opposed to just the Band-Aid potential of shelter. That program seeks to actually get them into something that's a little more permanent. All right, go ahead.
We were going to do a demonstration of a survey now, but I think what we'll do is we'll come back to this slide. I'm being a time manager here, so let's skip forward. Making groups of people that receive text messages was another thing we talked about on the introduction slide. When you can make a group of people that receive text messages over time, they outperform the control group. As numerous studies have cited, this is an early example of people getting text messages over time back in 2015. We see that the applied group outperformed the control group, and the people who were involved also attributed the text group involvement in helping them reach their goals with higher satisfaction. This was a 6-month trial. If we can skip to the next slide. Up in Wisconsin, there was another program that established the way to help people with stress management, blood pressure, waist circumference, things of that nature, all in an effort to try to help with their heart. What we're seeing in today's texting environments, though, is that people are setting up texting, and this is the tax program. People are setting up texting automation to handle people throughout the year. In Florida, for instance, this program is highly successful in keeping people financially fit. They have used the text sequencing to load text messages up over time, and it's become an incredibly viable and very significant program that was taken into Houston after it was developed in Florida, and actually got an award from Houston Money Week as one of the most innovative programs, successful programs in that market. So you can see that you can use a calendar to keep people in the know about what is significant to them at a specific time of the year and keep them involved with you over the year, which again goes right back to what people are finding with text interventions, and that these kinds of automated and live communication strategies can help people with their behavior. I'll skip to the next slide. Communicating with ex-offenders. This program has, in California, been quite successful in showing that there was a big reduction in people who violated probation. It's a very, very interesting way to use text, and currently we've got a couple of new criminal justice programs being developed out here in Ventura County and one in Louisiana. You want to skip to the next slide? Group messaging, as you saw in the earlier demonstration, where you can quickly take a group of people and send them all an alert, or you can send them all a message at the same time. We demonstrated that in the WIC segment, and it's quite effective. Mark, I know you talked a lot about being able to send group messages. The user interface will allow you to do that in a variety of ways based on data that you've gathered from a survey. People can be marked as a certain status. You can mark them with a marker in any kind of engagement. So the platform allows you to make these groups quite easily.
Can I add something here, Tom?
Yep.
One of the things that when we're focused on the texting, we end up spending a lot of time focused on our clients and going out there. What people forget is that this process can be used internally for teams, for staff management, for HR, public works, letting maintenance messages go out, and sending those. So don't just think about the ways in which this can be used with clients. Think about the ways you can use it internally with group messaging for staff management and other things too, especially. All right, go ahead, Tom.
All right.
Yeah.
In Ohio, one of the best ways to use the text service is to embed a link in it. Browsing with mobile devices has steadily grown over the past years and has now overtaken desktop browsing. And by this year, it's estimated that 80% of all browsing will be on mobile. And using embedded links in text messages to web pages will deliver content directly to individuals where they're most likely to view it. This was an example of a neighborhood immunization program where you text RC flu to 898-211, and you get back, very simply, all the places where you can go for immunization. Go to the next slide. Text for Tots, another great social program that helps provide to those that need it, and education that really has, if you go to the next slide, help with parenting, better family nutrition, more children hitting age-appropriate stages, more children receiving appropriate interventions and/or starting preschool earlier. Parents and guardians sign up for this service, and it covers kids all the way through ages 1 to 4. And there's hundreds, thousands of people getting this program. This is another federal program that's available to you to use should you care to. Numbers of federal programs that are available that are already built into the system, but this is just one example. Go to the next slide. The opioid epidemic, which was a big undertaking of ours this year, uses the texting program to do that same kind of sequential delivery of messages, but this time what it's doing is it's asking you to identify what issues you're most concerned with. If you want general information on opioid use, if you want resources for people that are concerned about someone who's using, if you want resources for someone who is using, and you might be that person, or if you're a professional, you can get information that's general in nature but up to the minute on best practices. This is developed in conjunction with United Way and has been implemented in, I think, 17 states now, and that number is increasing all the while. It uses automated surveys that help people get to exactly the information they want. Then it reaches into its own internal database to give back referrals that are immediately available to people who might be looking for detox information, medication disposal information, inpatient treatment services, outpatient treatment services, support groups. It's a wonderful program that's been attributed to gain better access to services that are in concert with national guidelines. And importantly, I think this will be the first slide if we go to the next slide. All the data that you are generating by text is instantaneously available to you in a visualized form. So in this particular example, these are the number of opioid request services that have gone out by specific zip code, and we can sort, filter with our dashboard by state, by county, by issue, by numerous ways to present your data to you. Also, there's file transfer protocols that are available for you, so you can dump and download the data and use it up to the minute for your own report services. There's a wealth of pre-made reports that are available to you that you can point and click to back on the user interface. When we get back to that part of the demonstration, we'll show you a little bit of that. But again, data and outcomes are where we are focused primarily on all of the work we do. So it's both implementation and evaluation. If you go to the next slide. There's an example now of a program that's there in Minnesota. This is a gambling helpline program. This is a way by which to demonstrate the selectivity, if you will, of a texting program that can drive out information that is in your zip code or near to you, like the opioid program does. This program does. We can certainly allow you guys to text the word HOPE to 61222 and go through this so that you can see the diversity of the different responses that you get. Depending upon which Minnesota zip code you put in, you will receive a different set of resources coming back to you, which I think is a good demonstration, and one that you can do at your leisure or do now. We wanted to leave some time for questions, and definitely want to open it up for a little bit of discussion. But I encourage you to do this. I encourage you to just text HOPE to 61222 and you'll see immediately how that program works to deliver back information that's tied directly to the zip code that you type in. Make sure it's a Minnesota zip code.
Yeah, for those of you living in Wisconsin.
Yeah,
homework.
come on.
Right here.
I'm going to pass this around real quick, and it's not meant to, we're not going to hand this off. We just want to know that when there's meetings, who's interested, who do we contact, or if there's anything further, yeah, just a follow-up.
Yep, and Mark Coopy is your follow-up. We've got a lot of information on our website, and Mark's got that information for you. We're available always at educationalmessageservices.com. Mark's got cards there, I'm sure, that can, help you get in contact with him. And truly, we want to try to leave you with the knowledge that we are an agency that is very active in developing programs. We have a huge wealth of programs already available, but we are also developing programs each and every week, so that with you all, as you see maybe a need or a desire, we're happy to build demonstrations for you that can show the kind of program behavior that you'd like to see. And I guess maybe we could have some questions if there are any.
Go ahead.
Can you ask for attachments? So for instance, let's say an individual needed to fill out an application and then at the end needed to attach some documents, let's say for income verification or something like that. Can that be handled in your system?
Did you hear that, Tom?
Yeah, it went in and out a little bit. Can you help me, Mark, with that question?
Yeah, the question has to do with if someone, let's say, is doing a survey and they needed to send in some attachments because they were asked for some information. Can attachments be sent in and added to this?
Yes.
I'm sorry. No, go ahead. This is web-based, correct?
Yes, so that's the one thing we forgot to tell you, that staff, when you sit down, you are logging into a website. So you're not doing this on your own phones or anything like that. So this is on a website that's HIPAA protected.
And it's a website, but it also means that it's device agnostic then. That he's on a Mac when he's demonstrating, and he's getting right in. And, I mean, it could be, from an iPad, it could be from
Yes.
a laptop.
Or
a
you can
desktop,
use your own
or
phone
another phone.
and go into the website without having all the text on your phone. So
So my other question is how long are these texts kept?
they want to know how long the texts are kept, Tom.
We keep the text in strict accordance with record retention. They're located in a secure data center, and they are retrievable at any time by you for any reasons by you. So they're kept indefinitely.
Go ahead.
Strict accordance to records retention and indefinitely don't match. And so that's not the question I was going to ask until you said indefinitely, and that popped into my head. And I'm like, wait, I had on my list also if there was purge capabilities built in, and that's kind of connected to a question around how agencies manage these texts in relation to their, in my example, it's electronic health record, but it could be others. Is it transferred into electronic health record, or how can we, our current practice is to avoid protected health information in text messaging if possible.
Well, we agree 100%. Unencrypted SMS for protected health information is not a recommended use for the service, nor do we build any programs that have PHI or EPHI.
But the application or survey information seems to go directly there, as well as inevitable exchanges with clients. It just goes there.
Yeah, this is something I think that you have to think about how you're going to manage. So like Canvas Health is using this now in chemical health.
Mm-hmm.
And so in the practice of case management or conversations with clients, you do not want to use PHI. So, and then you have to, again, there's a lot of things that stack up to say, there's like 4 elements that need to be present for PHI to be met. So typically you're not using last names, you're not using addresses, you're not using social security numbers, you're not using date of birth in these conversations. And so those are the kinds of things that you're trying to keep out of this. If you're talking about, I'm going to meet you here, or can you get this in or do that, most of those things don't reach PHI in terms of those kinds of applications. But you do have to be really cautious about that. You can't have a staff person all of a sudden start listing all of the things in the chart, that's the medical record for somebody and sending that off across the text message, just like they wouldn't do on their own phone if they're getting it.
Yeah. And to some degree, we can help monitor what staff do, but we can never control what the client does. So when they're sending it to us, it becomes out of our control, and suddenly we have a picture of their application with their full name, social security number, etc. Or they're just telling us, because that's just what clients do.
That's why with the application you can control whether or not you can receive images. You have controls over what content you can and cannot receive from the end user, and so there's controls there so that you don't get blindsided by, say, an application with a bunch of PHI on it, or a document with a bunch of PHI on it. You can say, don't permit the sending of images, and so, and then you can tailor your conversations to conform to something that avoids PHI. Unfortunately, you're right. I mean, that it meanders that way, and you have to try to judge that and control that. And right now, unfortunately, it's happening on a lot of people's personal mobile phones, right? And so, one of the not WICs, but health departments we work with, got in a little bit of trouble recently with some of their staff because they were receiving some images on their personal phone, and that got around or somehow got escaped and all of that, and so they felt like putting it into a software that is storing and archiving data in a secure way, is documenting all the transactions, is keeping track record, faithful delivery receipts, all of these things, has formalized their processes in a way that makes it more in line, in step with best practice. And so having structure and having a single concentrated place where all of this information is going, it helps conform to avoiding those pitfalls.
Also,
two other things. Go ahead. Wait a second, Tom. 2 other things about that is that if you're doing a survey for application and you didn't want to have the application on the phone, you could send them to your website where they would fill out the application on their phone. So that would be one option to avoid those things, so that you're not necessarily doing that through the texting, but you're doing a direct link like you showed you, and they just go directly in there and fill out the data. The other part of it that we used to have to do with the crisis system all the time too is we would periodically send out reminders, or after a conversation, if it looked like there were things on there that someone might not want, to remind the texter that, and that's where you could have a canned thing where you just click on it and say, remind you that if you don't want these things, you need to delete them off of your phone, because we know that some people's phones are being used by other people, and if they don't want to do that, creating reminders in there and sending them back out to people, because that's no different than someone coming in and asking for their medical record and you hand it to them. It's now in their possession. They have to decide whether or not they're going to protect it when they have it at home or not. So it's the same kind of management system I think we do with the phone.
Is there an answer to the purge question?
They want to know more about the purge. So, a lot of systems like EMRs and that, they'll do a total cleansing after 7 years and just clear the data and do that. What happens with data here after a period of time, especially if it's something like from a health department?
We'll follow the mandates of the health department individually. We're compliant to keep it for 5 years, but yes, I mean that that washing, that purging is something that we'll take on an individual basis.
Other questions?
We also
On the PHI, if I might, just for a second, on the PHI, the system is set up to be both two-way and one-way. Kaiser Permanente, which is one of our health providers out here, uses the text platform to communicate to people general information that is not consistent with PHI. The other thing is a covered entity. As we set this service up for covered entities, there are much tighter controls than if you're not a covered entity. As we've demonstrated a lot of programs here, numerous entities that we've demonstrated are not determined to be covered entities. So we're sensitive to the rules of what's called the Privacy and Information Acts that are in place to keep information, the right kind of information, being transmitted on what's called unencrypted or SMS platforms, such as the kind we're showing you.
We have another question, Tom.
Mine is more about using it internally.
Go ahead.
I guess I'd just like to know, if I'm sending from a computer, is it only going to a cell phone, or is it going to another internal person?
It's all SMS, and anything that you send off of this platform goes directly to the phone numbers you have in the system.
Okay.
That's the only delivery it will go to, is that phone.
Okay. So, how is this? Well, I'm thinking Skype, instant messaging versus this. What is that going to be different?
Well, so the question comes in when, depending on what you want to communicate, what is going to get their attention? Are they more likely, you're looking at the message that you need to deliver, and is that recipient, are they on site and you have another mechanism in place? It may not be as valuable. Are they on site and off site? Is it a weekend? Are they likely to get that message if they get it on their personal cell phone? And is that a vehicle? So, that's a great question. For tech in particular, we're wondering some of those same things with our notifications to the 5W. And then there is obviously Code Red. So there are some mechanisms already in place, and we're not, I don't think that we would supplant those, but rather there are opportunities or times where we have a group that it might be, a team that we have to get a notification to them, or, we've looked at it and said, okay, what if it's a weather event and we're saying, wow, everybody really needs to work from home today. How can we get that message out fast rather than somebody individually texting 50 people?
And Pew Research has it that right now 95% of people who receive a text message look at it within 5 minutes. There's no other communication system right now that has that kind of connection.
And none of us can deny it, because we're all sitting on it, right?
We're all doing it.
Yeah, I can get him to answer a text message before I can get him to IM and Skype.
Yeah.
I can't even get them to read their email for a week.
Email.
These are my own kids in college who might want money, right?
Yeah, the average for email is 3 to 5 days, and for voicemail, it's 7 days or never.
Lots of never.
Yeah.
Other questions?
No voicemail. No voicemail.
Yeah.
We have clients that don't even turn on their, or the end users don't even activate their voicemail. So imagine that. Pew Research says the number 6 thing that the most common mobile phone end user has, or uses, is, of course, text is number 1. Voice calls is number 6. So they do 5 other things more frequently than they make voice calls. That's the average U.S. mobile phone user, adult. And that's incredible. That really is remarkable that we have these mobile phones that were designed in the main to make voice calls, and we're doing that the least amount of the time we're using them.
Are there any last questions?
Yeah, sorry, one more.
All right, one
so
more.
If I'm sending from the web base, I'm on a desktop computer, I'm texting to the web, and I go on to something else, am I going to get any kind of pop-up notification when a text comes in?
Yes, you can set your systems up so that there's a little ding or a sound that does that. It'll show up on the screen.
Okay.
So yes, you can get notified when texts come in.
Is it like an opt-in feature, like if I want to have people opt into a method, I mean, would you do all that through like a website, or how would you actually get them to sign up?
There are several ways that you can think about that. One is that, when they're in, you can give them that number. Once they use the number, they can create an opt-in message that says, by doing this, you are opting into this. If you're okay with that, say yes, boom, and now they're in. So that technically covers them as being an opted in. You can also get the phone numbers from people and send them the message and then ask them to opt in. So either of those would work. If there's no other questions.
Some agencies
I'm sorry, what?
Some agencies will handle consent for SMS, and they'll blanket consent, like if you're consenting to communicate with us, then you're also consenting to have text from us. And so at that point, you could take their mobile number and pop them into the service. And much like you would put their mobile number into a database maybe, or a phone to call them, you would build your listserv in the software and the platform, and that becomes your electronic Rolodex, if you will, of all your clients. And like you saw in that email inbox, each of those numbers has a profile tied to it. So you can associate data related to the phone number that makes that a more qualified intake. And then, of course, all the messages that go back and forth with each of the phone numbers is faithfully being recorded. So it becomes a really, not just a place you might check every once in a while. It becomes a daily, you have to go there and to interact with your client. Again, it becomes a common practice.
We'll call it quits on this end, Tom and Jonathan. Thank you very much. Appreciate it, and we'll let people go.
Thanks, guys. Thank you.
Thank you all. Appreciate it.
I think we didn't talk